Hey everyone, Dr. Jackson here. I wanted to jump on and talk a little bit about that topic of the day, week, month, coronavirus, COVID-19. Recently, I had my office. We released a letter that I think I would like to read to you guys because we've got patients that also watch the YouTube channel in addition to colleagues and whatnot. But we released a letter, and and then we can discuss it a little bit, I think. Dear patients, at Oral Healthcare Professionals, the health and wellness and safety of our patients and employees has always been our top priority and at the center of everything we do. Given the heightened focus and quickly changing nature of the coronavirus, COVID-19, we want to make sure you're aware of some new practices we're putting in place and provide some important reminders about preventative measures. If you or anyone in your family experience fever, cough, or difficulty breathing, consult your medical doctor. We ask that if a member of your household is diagnosed with the coronavirus, please cancel any family appointments with our office and reschedule for a time after you're cleared by a medical doctor. We are a healthcare facility. We not only abide the strict standards set forth by OSHA, but we also go beyond what is required of us by law on a daily basis. To aid in the prevention of spreading any communicable diseases, specifically the coronavirus COVID-19, our practice has been engaging in deep cleaning practices several times a day, each and every morning and evening. Deep cleaning includes regular disinfecting of high-touch areas, including doorknobs, desktops, faucets, bathrooms, and chairs. We've removed difficult-to-clean items for public use, such as magazines, children's books, and toys. Additionally, we are encouraging regular hand washing and the use of hand sanitizer. Our practice is committed to well-being and care of our patients' oral health needs, and we will remain open and available to our patients as usual. The well-being and safety of our patients and employees is our top priority. We will continue to monitor this issue and take all necessary precautions to keep our patients and employees safe and healthy. Sincerely, your team at Oral Healthcare Professionals. So let's discuss a little bit. In dentistry, we in the dental profession have dealt with infectious diseases on a daily basis for decades. That's just what modern dentistry has done. People come in your office. Sometimes they may not know they're sick. Sometimes they might think it's something different. And they might be highly infectious with something. Everything, we see stuff from chicken pox to regular influenza to a little more rare, but still regularly seeing, things like hoof and mouth disease, hand, foot, mouth disease. Ultimately, it comes down to there are a lot of communicable diseases that come through all our lives, but especially in a medical practice. Well, how do we get around that? Well, medical practices, and specifically dental practices, we function on a concept of standard precautions. And standard precautions means basically when your dentist sits down, when I sit down with a patient and I'm going to do an exam or a filling or whatnot, we treat every patient as if they might be infected with something communicable. They might have influenza, they might have chicken pox, they might have strep throat or whatnot. These are things that ultimately we don't know. Sometimes the patients don't know. And we need to protect ourselves and the rest of the public and that patient. So we wear gloves, we wear masks, we practice, we wipe, we practice good hygiene, all sorts of things that you associate with a medical practice. Those are called standard precautions. Because of that, dentistry doesn't have to do a whole lot special to combat coronavirus. Little things can be absolutely done. We elected to, because of the virulence and whatnot, we elected to get rid of the magazines, at least temporarily, out of our waiting room. We wanted to get down to just hard, non-porous surfaces, so we removed the beloved kids train out of our little kids waiting room area, the kids books as well, even the cardboard ones. We want hard, non-porous, easy to clean and disinfect surfaces. Those types of things are, above and beyond, but ultimately I think that there's the right thing to do here. But also the right thing to do is to not panic. We are healthcare providers. This is something we're trained in, and we do this every day, as I mentioned. So we will be here open for you, for your dental needs, your oral health needs. and please give us a call if you should need us. Pretty much that's what I wanted to jump on and say here. If you have any additional comments, I always love hearing them. Go ahead and put a comment down below. I hope that I was pretty clear with just a nice message of that dentistry is a profession. We're ready for this. And there really shouldn't be a whole lot of speed bumps in your care as a patient, or frankly, in our care of you, because we've been doing this for a long time. Thanks so much for your viewership. I appreciate every single person who views, of course. If you like, please like the video, subscribe to the YouTube channel. When you do so, of course, we'd love if you could hit the bell button next to it, and it would give you, and you then select all. That'll allow for the bell notifications to come through on your phone whenever I upload a new video. In the meantime, everyone stay safe, everyone stay healthy, and I'll see you in the next video. Take care now. Bye-bye.